Hello, I want to welcome everyone to this live telephone town hall. I'm Sarah, a staff member for Congressman Tom Cole, and your moderator for this telephone town hall. Before Congressman Cole begins speaking, I want to let everyone know that you are in listen-only mode until you ask a question. If you'd like to be in the queue to ask the Congressman a question, please press 0 on your telephone. Again, to ask Congressman Cole a question, just press 0 on your telephone and you'll have the opportunity to describe your question and then return to listen. We might not have time for everyone's questions during the hour, but be sure to listen for your first name and location in case your question comes up. You'll have the chance to ask your question live on the call at that time. Tonight's conversation will focus on the ongoing response to COVID-19. To provide some additional perspective and to help answer some of your questions, Dr. Jason Sanders will also be on the line. As you might know, Dr. Sanders is the Senior Vice President and Provost of the University of Oklahoma Health Sciences Center, with overall responsibility for its 7 colleges and clinical, educational, and research programs. Dr. Sanders also provides patient care in internal medicine at OU Physicians and OU Medical Center. We're grateful to have him on the line. One last thing before we hear from Congressman Cole and Dr. Sanders. If you would like to opt in for future calls like this, please press 1 now. Again, to opt in to future telephone town hall discussions like this, press 1 now. Now we'll go live with Congressman Cole, who will share some important updates about the U.S. response to this coronavirus. Then we'll hear some opening words from Dr. Sanders as well. Congressman?
Sarah, thank you very much, and I want to thank all of you that have taken the time to join us on this call. Obviously the topic is very much coronavirus and what's happening, and let me provide a little bit of perspective and bring you literally right up to now on what's going on currently in Washington with respect to this particular virus. Remember, we're dealing with something that really is pretty unprecedented. In American history, probably the only comparable event would be the Spanish influenza outbreak in 1918 and 19, which was deadly. I mean, killed 50 million plus people worldwide, 635,000 in the United States. We haven't seen anything like that until something like this today. And remember, too, that literally 12 weeks ago, nobody in the United States really knew very much, if anything, about this. The United States wasn't notified by the Chinese government until December 31st of 2019 that they had a significant problem in China and that it was likely to spread beyond China. So everything that's happened has been responding in a very compressed period to a very contagious virus, and one that was previously unknown. In terms of that doesn't mean, though, that Congress has not been thinking about this for a long time. As a matter of fact, in the last 5 years, Congress, on a bipartisan basis, even in a very divided era, has actually increased funding for the National Institutes of Health by 39%. It's our premier research national institution. Increased funding for the Center for Disease Control by 24%. Increased the money for our strategic stockpile. That's everything from vaccines and drugs to personal protective equipment, masks, ventilators, you name it, by 35 or 34%. And actually set up a couple of years ago something called the Infectious Disease Rapid Response Fund. So there was money available initially to respond without any special action by Congress. In other words, when our medical professionals saw there was a problem, all they had to do was notify Congress. They could immediately draw down some money and begin to combat the virus. So there has been a lot done. But even with all of that preparation, this is quite extraordinary. And we've seen some pretty swift action by the administration. Obviously, in January, when the first few cases popped up in the United States, they immediately suspended travel to and from China and instituted quarantine protocols for people coming into the country. Later, when Europe, which did not do the same thing, became the source of a lot of the new cases popping up, that is, people traveling back and forth between Europe and the United States, again, another travel ban, mobilization of national efforts, etc. Congress has also been extraordinarily active during this period of time. We've already passed two supplementals, that is extra money to deal with this, plus a third that we will pass, if not tomorrow, certainly by the end of the weekend. That first supplemental was an additional $8.3 billion, largely given to NIH and CDC, along with some other particular agencies to respond, to begin to develop the diagnostic tests, to develop the therapeutics, to actually come up with means to treat people, and then longer term to develop a vaccine. But that's going to take some time. Vaccine would be a minimum of a year, more likely 18 months. But we are already testing in those areas. So a lot of stuff done there. There was also additional money set aside for state unemployment funds and for the extra nutrition monies, because we thought people would be out of work and be in need of those services. About a week after that, literally about, just about 2 weeks ago, a second supplemental was passed. This was more substantial, about $104 billion, and that was meant to provide individuals with some safety net and support. If they felt sick, not everybody works for companies that have sick leave. We wanted them to know they could have sick leave, and that the companies would be fully compensated, but everybody was guaranteed. We obviously don't want people coming to work because they need a paycheck when they don't feel well. We need them to stay home, and so we did that. We again strengthened the unemployment funds because we knew there would be job losses out of this, provided additional money for more supplies for the strategic stockpile, etc. Now, and by the way, it's worth noting, both those two bills passed with overwhelming bipartisan support. There are only 2 no votes in the United States House on the first one out of 435 members, only 1 no vote in the Senate. On the second bill, it passed again. I think there were maybe 40 no votes in the House, largely because it arrived late at night and not every member had a chance to follow it or read it. I was fortunate enough to be in a position to be able to do that. You can't blame people when they're grappling with trying to understand the legislation. Only 8 no votes in the Senate. And now the third supplemental, and this is an extraordinary bill that you're hearing about. This is literally the largest single spending bill in American history. $2.3 trillion mixture of direct expenditures and loan guarantees. To give you some idea of the magnitude, the entire federal budget in a year, including Social Security, Medicare, Medicaid, and what Congress directly appropriates, is about $4.4 to $5 trillion. So this is literally about half of what or more than half of what the United States would spend in an entire year in a single bill. And on top of that, so that bill is got a lot of moving parts to it. Just quickly to run through some of them. There's $350 billion, set aside for small businesses, so that as we shut down small businesses, and a lot of businesses are being shut down and do anything wrong, but those would be loans to help them keep their employees. If the money is spent toward the employee, and these are for companies of up to 500 people, there would be those loans will be forgiven as long as the money is being spent to keep people at work. We want to keep people connected. Even if they can't come into work, we want to make sure they get a paycheck. There's another tranche of better than $250 billion to make sure that every American that makes less than $99,000 a year or less than 75 would get $1,200 per adult. A family would get $2,400, and the family income limit would be $150,000, and that would apply literally to everybody. You don't have to be in the workforce. If you're not in the workforce, you still would get the additional support. On top of that, there's another $500 billion set aside in loans that the Treasury will make available to companies that employ more than 500 people. These would be large companies like a Boeing, for instance, or like our airlines that are obviously going through a very, very difficult spot, or in many cases We have large companies involved in recreational activities, cruise lines, what have you. So lots of support available. And again, extra money toward the unemployment funds. Every state, by the way, will be participating in this. There's another tranche of about $150 billion where there's money set aside. Every state will get at least $1.25 billion because we know they're losing a lot of revenue, and that money will be to help sustain them during this difficult time. There's money all the way down to the local level, to major cities. And then on top of that, money for tribal governments as well, which are pretty significant in this part of the country. So a really massive bill. That passed the United States Senate last night, 96-0. And again, while it took a few days longer than people hoped originally, to move a bill this size and do it 96-0 is pretty extraordinary. That bill will come to the floor of the House tomorrow. It will be debated, and it will pass. Now, whether or not we move and just have a voice vote, there's overwhelming support for this, or if an individual member wants, they can demand a voice vote. Obviously, the House of Representatives is not in session. There'll be members there, but we were on a break. The effort is to try not to slow things down for every member to have to come back, but if we have to do that, we will. And again, at the end of the day, this will pass overwhelmingly, and by next week will be the law of the land, and these resources will be available. Well, obviously, it takes time to distribute them and to move these programs in place. I would also say, don't think of this as the last bill. Secretary of the Treasury, Mnuchin, who has been assigned as the person to deal not with the disease part of this, that's the coronavirus task force that the president set up along with our normal healthcare professionals, again, NIH, Center for Disease Control, our people that run the strategic stockpile, and your state and local health departments all across the country. They'll be dealing with the disease end, but economically, Mnuchin will be handling that. And he likes to describe this whole thing as a baseball game, a 9-inning game. And you should think of the two supplementals as probably the first and second inning, this third one as a third one. There'll be other legislation, particularly when we have a chance to see, whether or not, what kind of impact this bill has had on the economy. We had an extraordinary number this morning, obviously 3.2 million Americans applying this week for unemployment compensation, which, by the way, they don't have to wait on. There's usually a waiting period of a week. Not in this case, because, again, we know these people are losing their jobs through no fault of their own. Just to give you some perspective, the highest number we've ever had in a week apply for unemployment before new claims is about 700,000. So this is close to 5 times as big as we've ever seen before. And we're going to see some other tough numbers coming forward. But the government will be responding very robustly as we go forward. And I think Congress is moving, frankly, pretty expeditiously and in a very bipartisan way. You don't find any difference between Democrats and Republicans on wanting to make sure resources are available to help individual Americans, small businesses, and to make sure that our economy stays up and running. I could go on, but why don't I quit there, and then I'm going to ask Dr. Sanders, who, by the way, is a good personal friend, and we are very fortunate in Oklahoma to have somebody of his caliber serving as the provost for the OU Health Sciences Center, to talk a little bit about how he sees things developing in Oklahoma and some of the preparations that are being made by our medical professionals right here in Oklahoma. So if I can, Dr. Sanders, let me turn it over to you.
And I've had the pleasure to work with the Congressman for over 5 years now as provost here at the Health Sciences Center. I want to first highlight for our listeners, as we all know, that Congressman is an expert in U.S. history and really applies lessons from the past to our policies today. I really want to commend Congressman Cole, as everyone knows, for his general leadership and truly being a visionary, a voice for the role of health and public health, a voice year after year for investments that make sense for our country's preparedness for infections and other health threats, a voice and supporter for research to prevent and treat major diseases. And he certainly commands the respect of everyone here at OU and our physicians and healthcare providers across Oklahoma and truly across the country. I hope the listeners understand when we go to national meetings of physicians and academic medical centers, Congressman Cole always get asked how Tom is doing, how much everyone appreciates his leadership. For our listeners, I did want to cover a few topics. We know this has been on everyone's mind, but to go through a few things about what we're facing for the coronavirus. This is a virus. There are other viruses such as the flu and what people refer to as the common cold. Unfortunately, this virus, as Congressman has mentioned, has emerged quickly and is different than other viruses and poses a significant problem. It spreads from person to person, and on average, every person who's infected spreads it to 2 to 3 other people. And this can be spread in a variety of ways. For most of our listeners, the main 3 ways that could be spread is if you're by someone who coughs, and if you're within 3 to 6 feet of that person, that's why you've seen some of those distance recommendations that can get transmitted through a cough droplet. If you directly are in contact with someone, you can spread the virus, and then even indirect contact. So if someone who's infected has significant contact with something that then you contact, it can transmit it that way. One of the other difficulties with this virus is that even when someone doesn't have any symptoms, maybe isn't coughing, and really may not have no symptoms at all, they can still transmit the virus. That currently is estimated at 20%. So of every 100 people who have the virus, 20 may have no idea that they're carrying it. And the other challenge with the virus is it continues to spread for up to 20 or 30 days. The last thing is this virus causes more severe and critical symptoms than flu or other viruses. So it is a significant challenge. For our listeners, for those this time of year in Oklahoma, their allergies, most of the flu infections have really nosedived through March. There is still some flu circulating and some other colds. But things to pay attention to, I'll just mention 4. If you have a fever, and some patients don't, people, every day if you're going down the street, you don't check your temperature, but if you get chills and feel cold, that actually is a symptom of a fever. If you have a dry cough, if you have fatigue and body aches, those are the symptoms that really stand out most commonly with this virus. But it's difficult to pin down. If you look even at patients in Oklahoma versus patients in Europe or China, the percentage who have fever have varied country to country. So how we're responding. So 2 things on this. I'll start in general for how we as a nation are responding and mention some specific things to Oklahoma. So our message really has been to stop the spread of this virus. As I mentioned earlier, it's a significant virus that we face and requires really at the beginning a significant public health intervention, and huge appreciation to Congressman for his leadership for the economic toll this virus is causing. So you have a health threat and economic threat at the same time, and so appreciative to Congressman and other leaders in Congress for addressing it. So we are really messaging. We've done that here at OU Medicine to stop the spread. The other term you probably heard is bending the curve. That means that we are working to get as much data as we can about those who are infected in the United States. And even with the current status of trying to ramp up our testing, we can at least compare infections in the United States to other countries and use that to make policy decisions. And that's why you've seen Governor Stitt, for those in different localities as well, different actions by different mayors about really trying to have an intervention now to stop the spread of this virus. That really helps our healthcare system. In China and in Europe was observed what's called a surge of patients. You may have seen that in the press. And we're just trying to match the capacity we have in our health system, and we're certainly increasing that from a normal functioning of our health system to match a sudden rise in patients with the coronavirus infection. So that's the public health measures. In parallel, the last point on our general response is working to develop treatments now, and certainly, as Congressman said, a vaccine. That is one thing that we've done locally. We have already at OU 2 vaccine projects we're working on, one which is in preclinical testing, so before it's tested in humans, and one that is one step before that. We call that the discovery stage. So far, we publicly announced that the discovery stage vaccine is a novel or new way to do a vaccine, and one in which is not done for the majority of vaccines. With all these, we don't know if they will work, but we're doing the most that we can with our research expertise to be part of what will certainly be the definitive end of this virus vaccine. In the meantime, working on our treatments, looking at clinical trials of medications that can help, and then otherwise preparing our capacity for patients. So in Oklahoma, I'll just conclude with a few specifics. Here at OU and across the state, our health systems are working together to prepare, to use this time to prepare for every scenario, and importantly, if there is an ongoing rise of patients, to be able to meet their treatment needs. We have sent the message to patients that 80% roughly of patients just have mild symptoms and can be treated at home. So we've increased telehealth visits and phone visits to talk with those patients, get the medical information, and if they're safe, to stay at home so they're isolated and not infecting other patients. And for those patients who need care in our hospitals or in our critical care areas, we are providing plans to the governor for how we'll work together to increase that capacity, the physical facilities, the equipment, the ventilators, the personnel, our physicians, our nurses. And the very last thing I'll say on this topic, and then go back to Congressman Cole, is we do have a significant need for what we call personal protective equipment, or PPE. These are masks to be worn by our healthcare providers, face shields or goggles, gowns and gloves, and particularly you've heard masks and face shields. So we've really appreciated those who've been able to donate supplies they have. Local businesses in Oklahoma have already stepped forward. We're hugely appreciative, who said we can retool our production to make masks. That is very helpful. It is an area whereas we are stewards of resources and trying to prepare for the surge of patients. We're really trying to conserve the amount of equipment that we use, but as we're already treating patients with this disease, we have to use a large amount of it to try to keep one patient safe from another, and also our providers safe so they can continue to fight this disease. So thank you very much, and Congressman Cole, back to you.
All right. Before I think it's about time to take our first questions, but if you would like to ask a question of Dr. Sanders or Congressman Cole, press 0. Our first question comes from Dean. You should be coming live.
Hey, Dean, how are you?
Hey, Tom, I'm doing great. I
Great.
appreciate you taking the time for this. I really do. That means a lot to us out here. I got a question on these checks that you're going to give out, the $1,200 deal. Now, does that go to Social Security people as well?
Yes, it does. It's anybody that makes less than $99,000 a year. So it'll take a while, probably take about 3 weeks. But, yeah, if you're on Social Security, you're still eligible for that.
Okay, we'll move on to our next question. It's Varian from Rica, but before I bring him live, just a reminder that if you would like to ask a question, just press 0 and you'll have an opportunity to record your question and then return to listen. And again, if you'd like to ask a question of either Dr. Sanders or Congressman Cole, just press 0. Varian?
Yes, I'd like to find out what about help with the utilities and stuff for the seniors.
Well, there will be, again, that's what this additional $1,200 is for. There's not additional help beyond that at this point, although I suspect there may be down the road. A lot will depend on how this works. But again, everybody's eligible for that $1,200 per person, or if it's a couple, $2,400, or if there are children there, additional $500 for each child.
Okay, our next question comes from Casey from Moore. Again,
hey. Hello.
Casey?
Yes. Can you hear me?
Yeah, go ahead.
Yes, you can. Thank you.
Okay. My question is, I'm supposed to graduate this May with my master's in social work. I was doing a practicum with the VA, and we got pulled from our practicum sites. Social workers, I don't know a lot of people know what we really do, but we could be doing case management, resource acquisition, and things of that nature, and we've been pulled from those positions. So I hear about nurses letting them graduate early and doctors and stuff like that, but I'm not hearing anything about social workers.
Well, that's not something that I could address, and I'm not going to ask Dr. Sanders whether he can or not, but that's a decision made, by state officials and by the academic institutions. That's not really part of any of the legislation that Congress has passed. They've been pretty aggressive in New York, where they really are short. I mean, they are the epicenter currently inside the United States. So, there's 3,000 counties in the United States. Over half, or about half, the cases are in 10 counties. 5 of those counties are in or around New York. So they've taken some extraordinary measures to mobilize and put more people on the front line. I really couldn't tell you whether or not we're at the point that we would need to do something like that in Oklahoma.
Casey, I can provide an educational perspective. For our students at the Health Sciences Center and our different programs, we do have rotations for different programs at clinical facilities, and other clinical facilities have limited student rotations. I can't speak specifically to the VA Medical Center, but I know that others have. I think their response has been a lot of it driven by personal protective equipment, from what I've heard, and that's the challenge as we face this so quickly. Certainly we work for each of our students in health professions. Social work, formerly at the University of Oklahoma, reports up through the Norman Provost, although we have a lot of joint programs with our health professions here at the Health Science Center. But we've been working with accrediting bodies to try to have flexibility for students in particular set to graduate this year. If there's things that can be done instead of the formal clinical practicum. And we're also thinking ahead of time for our students who graduate next year. So far I've been encouraged, but it has moved quickly, and it looks different for different students. We had actually, so some things are online. Actually today we worked with a national accrediting body in one of our health professions for something that we did safely on site with social distancing, but a modified traditional practicum. The last thing I said, I appreciate exactly what you say. We need a healthcare team and workforce to address this and other issues, and I think we're seeing that, so especially throughout the United States, of areas that are having a lot of viruses. And I think you'll see more flexibility and certainly the recognition of the value that you with your social work training and others can provide.
All right, we'll move on to our next question, and this one's coming from Alyssa from Blanchard.
Hey, Alyssa, how are you?
Alyssa, are you there?
That's Melissa, if you have the right person.
Sorry, I think it must be Melissa. Sorry about that.
It's okay. Congressman Cole, I understand that the Senate bill does not pay for treatment for COVID-19 infection, especially COVID-19 pneumonia. How on earth is the average American going to pay for that? Governor Cuomo says a non-COVID-19 ventilator experience is usually 3 to 4 days, but with COVID-19 it's 11 to 13 days. How would the average American, especially an Oklahoman, pay for that kind of treatment?
Well, I think there actually is money in there to pay for some of the treatments. And again, there'll be additional bills coming forward. But actually, the main part of this one was to try and make sure that the people that were losing their jobs had additional support, in small businesses that were going under had additional support. But there'll be other means of addressing some of this stuff. And there is a panoply of people. If you can't afford the care, certainly Medicaid is available and other things. But again, I suspect that'll get looked at. But we had to move pretty quickly here with the economy, honestly beginning to hemorrhage jobs at an unprecedented rate.
All right. Dr. Sanders, did you have anything to say on that, or we can move on to our next question?
No, nothing to add.
Okay. Our next question comes from Sherry from Elgin.
Hey, Sherry.
Hello, how are you?
Good, thank you.
Well, I have some concerns. I have a husband that is at very high risk. He's 62 years old. He's still working at this time, but he works on post out at Fort Sill, and we just got word today that there was a confirmed case there. My question is, he has no sick days. Was that 2 weeks worth of sick days? Has that been implemented here?
Yes, it has. He should be able to get sick pay. I mean, the company can provide it. And frankly, they're mandated to provide it, and they'll be fully reimbursed. So he should have 2 weeks. If it's longer, I think there's up to 12 weeks. I'd have to double check that in some circumstances, particularly looking after family members. So there should be a measure of protection for you there.
All right. I'll move on to our next question. But first off, if you would like to ask a question, press 0 and you'll be able to record your question and then return to listen. Again, if you'd like to ask a question, press 0 and you can record your question and then return to listen to the call with Congressman Cole and Dr. Sanders. We'll move on next to Phyllis from, I'm not sure where Phyllis is from actually. Are you there, Phyllis?
Yes, Norman.
Okay. Hi, Phyllis. How are you?
I'm fine. How are you?
Good, thank you.
My question is, my position is a little bit unique on where do I fall in with about any of pay that could come. I am a registered nurse, but I am also a nurse educator. So I teach at a couple of universities, and I teach at a technology center. So I'm paid per class, contract for each class. So I'm basically a private contractor, but I'm also employed by East Central University and Norman. But my pay is based on how many classes I teach. So I don't know where I fall in to get help. So with all this, because my income is completely cut now.
I'm sure. Well, first of all, thank you for what you do as a healthcare professional and an educator. As I understand it, you should be eligible for this grant, which they're going to try and move this pretty quickly, direct deposit. I mean, so if they've got a way to get you money, they're going to do it. They understand that, and there's even been quite a few exceptions made to people in the past that might not. This isn't unemployment, but I'm just using that as an example. We're really expanding. They're going to be very liberal in their interpretations as to who's eligible. So it sounds to me, at least, as if you would be eligible. But we'd be happy to work with you, obviously, to make sure that happens.
All right, we'll move on to our next question. But first, if you'd like to ask a question, press 0, and then you'll be able to record that question and then return to listen. Our next question comes from Jean from Norman.
Hey, Jean.
Are you there, Jean? I don't think. Must have lost Jean. We'll try another question. Julia from Midwest City.
Hey, Julia.
Hello. I was wondering if any of the truck drivers or airline pilots that are delivering goods, like medical supplies and also food and other household essentials, is the trucking industry and the airline industry going to continue on if any accidentally get this?
Well, obviously, if somebody got it, we would want that person to call their healthcare provider and quarantine themselves immediately. But they would still be eligible for all the benefits. Whether because they couldn't come to work, they had to claim unemployment, they would actually get a much more generous unemployment check than normal. They still would be eligible for, again, this one-time distribution of money, $1,200 per adult, $500 for children. And so, yeah, they should be eligible for the full panoply. There's going to be special money set aside for the airlines because we recognize now, there's still, even though a lot of people aren't flying now, a lot of flights are being canceled and cut back, we still move a lot of cargo. That's not affected by this by air. So the airlines themselves will be well compensated. There was also some things in the bill relating specifically to the trucking industry. I mean, you can't move the economy if you can't move goods. So I think there's going to be, people in those industries are going to get support for the industry and then are certainly eligible for anything that's available to any other individual.
All right, we'll go ahead and move on to our next question. That is Warren from Norman.
Hey, Warren, how are you?
Fine, sir. How are you?
Good, thank you.
What's your question?
Oh, I thought it was recorded. I'm sorry. What I was concerned about is on this rebate of $1,200 per person and or $2,400 for a couple. Does that income, is that cover people who just have retirement income? Because that's all we have.
It does. It does cover you. If you only had Social Security, you'd still be eligible for this. You do not have to be in the workforce to be eligible for that payment.
Okay, we'll go ahead and move on to our next question. Her name is actually Sarah.
Hi, Sarah.
Hi, Sarah. Hi, Representative Cole. I have a question for both of you folks, for you and Dr. Sanders. So the governor's safer at home policy seems to be a bit of a patchwork at this point. Is that enough to flatten the curve? And then the follow-up question, is there a point at which all Oklahomans need to stay at home and only leave for groceries, pharmacy trips, doctor's visits, like other states have done, to help flatten the curve? Thank you.
Jason, why don't I let you're the expert on this, go first, and I'll follow up.
Sure, I'd be happy to. Thank you very much for the question. In terms of our response, we're able to track United States infections for the past several weeks, and the governor's already convened on his task force epidemiologists to model this. And we can compare it to China, Italy, other European countries. And it's tracked every day and compared. So we'll find out as the current policies are implemented in the coming days and weeks just where we are. And I understand that the governor and mayors, all of our leaders, our healthcare community will be tracking that. If I could provide an example of another country, even when some countries have flattened the curve, they've had another rise later. So the short answer is we won't know until we proceed over the days and weeks. It's an important intervention, and I really feel that we're aligned in the state that we need to take this. It's significant and appreciate the federal government, Congressman's leadership, because it does cause a lot of strain on our economy at the same time. So the modeling will continue. The test will help. We're able to do modeling now with the number of tests we do have, but the number of increased tests will help. So hopefully that answers a bit of your question. It's a fluid situation. I think we'll have to continue to adapt, and as part of we're looking at Oklahoma, you've seen across the country, it'll be very county by county, city by city. So you may continue to see different approaches depending on the severity of the infection and its increase.
Now, let me add a couple of points for what they're worth. We have some countries that have done this nationwide. Others, including China, did not. I mean, it was an extraordinary step. They quarantined tens of millions of people, but not everybody in China, not every province in China. And they seem to have gotten to the other side of this thing. So a lot of this these decisions will be made by governors on a case-by-case basis. Actually, the president, any president, does not actually have the authority to do this. It's usually done, at the state and local level. And you'll see a little bit of a patchwork. Certainly that's emerged. We see very different regimens in this regard in Oklahoma City and Tulsa and Norman, for instance, than we do in rural Oklahoma. Now, that may change. The governor may decide that as he gets more information and gets the best advice from our local healthcare professionals that he needs to extend this, but they probably don't have the data yet. We need more testing, and I would just say stay tuned. But other countries have dealt with this successfully, some in very different ways. Italy is now locked down over the entire country. Again, that was not the case in China. So again, I think, and there's obviously a bigger propensity in metropolitan areas where the population is much more, closely packed than they are in the rural areas and rural states to do this. So I think it'll be a while before we know, but the authorities are there if and when, the governor decides he needs to do that.
All right. We'll go ahead and move on to our next question. But again, if you'd like to ask a question, press 0. And if you'd like to opt into future calls like this as well, press 1. Our next question is from Zora, and she's from Paul Valley.
Hey, how are you?
Can you hear me?
Yeah.
I can.
Oh, good. I couldn't remember I had mute on. My question was about, like, Pauls Valley and several other rural places in Oklahoma have lost their hospitals, and I was just hoping that if there's any good thing that could come out of it, if we need those beds, maybe we could bring those hospitals into play so that they could help out.
I'm going to let Jason go first, and then I'll follow on that, too, if that's okay.
Thank you very much for your question. The governor, through State Department of Health, is collecting an inventory of exactly what you mentioned, prior hospitals, prior long-term acute care facilities, prior skilled nursing facilities, other large facilities across the state. And he's putting together that inventory through State Department of Health, just as your idea. We've had ideas, other health systems, so we're putting that all together to go through in a prioritized fashion for a statewide response. And the ways we've looked at those facilities are both before someone may need critical care and after someone may need critical care. Again, current numbers are about 80% of people who are infected have mild disease, can stay at home, but there are up to 20% who have severe or critical symptoms and need critical care. So we're looking at facilities that could help triage patients as they're starting to get sicker from home, maybe having more symptoms but not yet needing a hospital admission. And on the other side, as patients recover from their hospital stay, traditionally we would keep them in the hospital a bit longer, but as we're trying to meet more patients' demands, we'll look for facilities to be able to discharge patients more quickly to recover kind of a transitional facility before they go home. But all that is being collected now. This is the time to prepare. And as you've seen, the significant attention here in Oklahoma, that has been so much of the activity to prepare now to have those plans together in the weeks ahead. The only other thing I would add is in addition to the facility, you need personnel and equipment and you're also seeing inventories at the state level every day of bed capacity, ventilators, personal protective equipment, and we are planning our staffing as well. Certainly, in our rural areas of the state, that's always been an area of attention of how do we have sufficient access to patients and healthcare professionals to staff those facilities, and that's going into the planning as well. How much care do we need in a local area versus the ability to transport patients to more centralized areas? So more to come on that. That's so much of the preparation going on now.
Just a couple of additional things on that. In the bill and I didn't mention this up front, the current supplemental that will be voted on, hopefully passed tomorrow, but certainly by the end of the weekend, there's about $130 billion set aside for hospitals. Our hospitals are making an extraordinary sacrifice right now. A lot of them are voluntarily foregoing elective surgeries, which is a huge percentage of their income. I know I had an opportunity to talk to the chief administrator of Norman Regional, and when they made that decision, because they don't want to overuse equipment and not have that available if we get a surge of coronavirus patients, they're foregoing $13 million a month. I know OU Health Science Center and their facilities are having to make these kind of choices. So we have a stream of revenue both for them, and again, the money that will go to the state of Oklahoma, which will be considerable, be a minimum of $1.25 billion. The governor will have enormous flexibility once they make the determinations that Jason outlined how to deploy those monies. So we're going to, if that makes sense in Oklahoma, we're certainly going to try to provide the resources so that if that's the decision that the governor and his medical advisors come to, they've got the wherewithal to do it.
Okay, we'll move on to our next question, and this one comes from Wilma from Moore.
Hi, Wilma. How are you?
Hi. I'm Wilma Lupton, and I live in Moore, Oklahoma. And I am listening to the count jump as to the number of people infected, and I'm getting concerned, more than concerned. First of all, do you think it's a good idea to try to reopen robustly a bunch of businesses, churches, and what have you by Easter? And secondly, do we have anything in mind for elderly people like myself who might not be able to get out and say, go get a gallon of milk because they're too scared to? I do have children, however, I don't want them getting this disease either, and bringing it in to me as they bring me the milk. So is there a plan for elderly people who live alone? And by the way, I know who you are, and I also know your dear mother, who I respect very highly.
Thank you very much. You're very kind to say that. Well, let me first, and then I'm going to turn it over to Jason as well to respond, because part of that was a medical concern. Again, in terms of the financial wherewithal, that's available for everybody. In terms of distribution, there's nothing in the legislation that really gets down to that. I mean, some of this is friends helping friends and neighbors helping neighbors. But you're very wise to be concerned. I'll let Jason tell you what the main factors are you should worry about and how you should handle it. But again, just rest assured that there will be resources available both for individuals to help them get through this, and certainly a lot of additional resources available for our healthcare providers, because they're under enormous strain. And frankly, I'll say this again, I'm sure at the end, but I want to thank anybody who happens to be on this call that is a provider, because they literally put themselves at risk when they're taking care of other people. And that's why this whole issue of protective personal equipment is so important, that we make sure that they're like our soldiers in a battle. I mean, you don't send people to battle without having them appropriately armed and protected and body armor and the tools that they need. And, we're strained in some areas right now, and we've got to overcome that. But certainly we'll do anything we can to be helpful to you and your family as you work your way through this. Jason, you want to opt in on the medical end of this, and for somebody particularly that would be in a high-risk group and perhaps have young children there as well?
Yes. Wilma, thank you for your question. We're certainly all have some fear. That's natural to be human, and all taking it seriously, and I particularly appreciate the recognition of your own risk. The medical risk does increase with age. It's striking when you look at the data. The good news is that so far, young children and teenagers appear not to be severely affected. But after that, as you move on through ages, every year of age is an increasing risk. So for everyone on the call to be as safe as possible, and certainly if you're an older individual, your risk is increased. The other risk that's increased, again, having a severe outcome to this infection, severe symptoms needing hospitalization, potentially critical care. It's other diseases you might have, so diabetes, so blood sugar problems, if you have high blood pressure, if you have heart disease, if you have a lung disease, particularly if you smoke tobacco. And in fact, one thing I have advised when I've had this opportunity is for those who are smoking or vaping, this is an additional reason I'd really encourage you, at least during this outbreak, do as much as you can to stop smoking, because even the lead time of a few weeks to months of having stopped smoking can help your lungs respond. But as you look at the data, not only age, but as you go from 0 major medical conditions to 1 to 2 to 3, with each increasing medical condition you have, patients have more severe outcomes. So I want to share that very transparently for everyone to assess your own risk, because regardless of what those around you do, there are very personal choices in your own self-isolation, how you interact with others. You mentioned your children. And it's a challenge that patients can have no symptoms and still be transmitting it. Things you can do: wash your hands, be mindful of anyone around you who's coughing, to leave that environment. If you have a mask, put it on, to at least stand 6 feet away. To be mindful of when you're eating, really wash your hands well. You've probably seen an extended hand washing. Try to get to 20 seconds, which is probably more than you normally would. Be thoughtful about touching your face. This virus is transmitted through the nose, through the mouth, and the eyes. And people just, you've probably seen this, you touch your face a lot during the day. So try to be mindful of that. And particularly if you're a higher risk category, there are things that you can do during the day, just personally, regardless of what's going on in your community, to try to reduce your risk. So hopefully those are a few things that help. We really want to give people information to try to stay as safe as possible.
All right, I think we have time for one quick question, and then we'll need to wrap up the call. But our last question comes from Dale.
Hi, Gail. How are you?
Oh, good.
Dale.
Good, Representative. I basically got a question for Dr. Sanders. Back in the early 1900s, when we had a similar outbreak like this, the military surgeons prescribed fresh air and sunshine. How big a deterrent is that? I'm involved in agriculture here in southern Garvin County, so I'm out and about in the fresh air and sunshine all the time. Is that a deterrent to helping control this virus?
Thank you very much for your question, and that exactly is one of the historical precedents we're looking at. So in terms of being out in the open, that helps because you're typically farther away from other people versus a crowded metropolitan area. It's windy in Oklahoma, so I think the wind, kind of like sweeping down the plain, is going to blow away the virus pretty well where you are. So I think working outdoors is great. It's starting to warm up. In terms of the sunshine effect on the virus itself, it is true that flu and other viruses in the summer months start to decrease. Part of that's just people being farther away from each other. Part of it is that the heat or direct sunlight could cause destruction of the virus faster if it's sitting on a surface someplace. That's not known yet for this virus. We'll get better data. But I certainly think being outdoors is not only a safe place to be, but important for everyone with the stress of this. So even if you're in a kind of a semi-urban area or an urban area, getting out and taking walks and enjoying the sunshine, this is really transmitted with pretty close contact to people. And that 6 feet, those droplets in the air are someone who's coughing within 6 feet of you. Unless you're in some rare situations in a hospital where what we call it an aerosol happens, it's not floating through the air. So I think you're in a good situation. Hopefully other callers have an opportunity to get outside and get some fresh air. Those aren't treatments for the infection itself. Those are just kind of your environment, and whether you have risk or not, the sunlight question, it may or may not destroy the virus. Not treatments, but certainly I think good for everyone's well-being.
All right. Well, we are near the end of our telephone town hall, and I'm sorry we couldn't get to everyone's questions, but you'll have the opportunity to leave a message and receive a call back from our office after Congressman Cole provides some final words. And just one quick thing, if you would like to opt into future calls like this, press 1. With that, Congressman?
Well, first of all, I want to thank Jason for taking the time to join us and talk to so many Oklahomans. There's an enormous amount of work that he's undertaking, enormous responsibility and pressure, and for him to take the time here to respond to questions just tells you what kind of healthcare provider and person he is. So, Jason, thank you, and please thank, not just from me, but I know everybody on this call, the men and women that work with you every day that put our health and well-being first and foremost, and frankly run considerable risk, particularly in a situation like this, so they can take care of us and those amongst us that fall victim to this virus. So we are very grateful for that. In terms of the folks on the call, number one, thank you too. Thank you for taking the time, and thanks for the questions. And we will be working through this. You've got particular questions, particularly about this third supplemental. There's going to be a lot of them. Just give us time. We're digesting the bill. Get to benefits that this bill will provide, whether you're a small business, certainly just an individual, let alone, heaven forbid, if you're somebody who's been placed out of work. We want to do anything we can to be supportive of you. Finally, I would just say, while this is a difficult and troubling time, please know that the government really is mobilizing unprecedented resources in a really extraordinary way. We haven't done anything like this. We didn't honestly have the ability 100 years ago to do these kinds of things, but there's a really strong bipartisan commitment to try and make sure that we get through this, that individuals get the help they need through it, that we have the resources in hand to make sure our economy recovers robustly. And finally, if you would, just think about your friends and neighbors through this. We've had a number of people that mentioned that they were worried about going out. If they're in a high-risk category and you can help them out by picking up something at the store for them, or just checking on them, particularly if they're by themselves, that would be a wonderful thing to do. Just reach out to your friends and neighbors and provide them that encouragement they need, that support. It really helps if somebody looks in on you. You can just call them on the phone or meet up where you can and provide them the assistance they need. Nothing government can do can ever replace the compassion, the decency of the American people and their willingness to help one another in tough times. And I think Oklahomans are probably as good or better at that than just about anybody in the world. So as you cope with your, please take a little time to think about your friends and neighbor. Last point, if you're one of us that is fortunate enough and your job's not at risk and you're in position, please help some of these nonprofits, our food bank programs, our programs that are providing folks that are like the City Rescue Mission up in Oklahoma City. People like that are expending enormous resources. And think of your churches as well. because if you can't gather on Sunday, and many churches can't, they still need the ability to help other people. So just think broadly if you can, if you have the ability to do that enough. There's a lot of people that are hurting and in tough situations, and your willingness to help them will make all the difference going forward. So with that, Sarah, that's all I've got to say, and I'll sign off and let you close us out.
Sure. Thank you, Congressman. And thank you again, Dr. Sanders, also for providing your insight and expertise. And thanks to those who joined tonight's call. If you'd like to leave a message, please press 1 now. Again, if you'd like to leave a message, please press 1 now.